Good morning, everybody. It's a privilege and pleasure to spend Saturday morning with you. As was said, if there's anything that I say that during my talk that makes you confused or worried or anxious, just put your hand up, stop me, we'll talk about it, then we can move on. So just some disclosures. I do receive grant funding from the National Cancer Institute, which is part of the U.S. government, the American Institute for Cancer Research, as well as the Susan G. Komen Foundation. These grants are paid to LSU Pennington Biomedical. They don't necessarily come directly to me. They're used to support our cancer research program here. So I want to start with the quiz first. And I want to try to understand if you guys know how common or rare cancer is among women. So I'm going to give you a scenario, then we're going to close our eyes, and I want everybody to raise your hand based on which answer you think is the correct one. So we talk about lifetime risk of developing cancer in women. And there's three choices. 1 in 3, 1 in 10, 1 in 25. And what those options are is if we took 3 women and followed them from the beginning of their life all the way to the end of their life, one of those 3 would develop some type of cancer. 1 in 10 is if we follow 10 women from the beginning of their life all the way to the end of their life, one of them would develop cancer. 1 in 25 is if we followed 25 women from the beginning of their life to the end of their life, one would develop cancer. Okay? So I want everybody to close your eyes, and I'll give you the options, and for the answer that you think is correct, I want you to raise your hand. So if you think the lifetime risk of a woman developing cancer is 1 in 3, you can go ahead and raise your hand. Okay, you can put your hands down. If you think the lifetime risk of a woman developing cancer is 1 in 10, you can go ahead and raise your hand. Okay, you can put your hands down. And if you think your lifetime risk of developing cancer is 1 in 25, you can go ahead and raise your hand. Okay, you can put your hands down. You can open your eyes now. So what I saw from the front of the room is that about half the room, a third of the room, thought it was 1 in 3. A third to a half thought it was 1 in 10. I would say that was probably the most common answer. And then there was about maybe a quarter to a third of the room that thought the answer was 1 in 25. So the correct answer is 1 in 3. So it's actually quite common. 1 in 3 women over their lifetime will develop some type of cancer, and this is true for your male loved ones as well. So for myself, my lifetime risk of developing a cancer is 1 in 3. So cancer is much more common than we often think it is, and the goal today is to talk about ways to help reduce your risk of developing cancer, or if you have already developed a cancer and have been treated or are receiving treatment for it, how you can do things to be able to optimize your survivorship. Okay, so because of how common cancer is, nearly 12,000 women develop cancer in the state of Louisiana every year. The most common cancer is breast cancer. It accounts for nearly 1 in 3 of all cancer diagnoses in women, followed by lung cancer and colorectal cancer. These 3 cancers account for more than 50% of all new cancer diagnoses in women in the state of Louisiana. And although we've made tremendous progress in our fight against cancer, more than 4,000 women in this state die from cancer every year. And the large majority, about 1 in 4 of all cancer deaths in women in this state, are due to lung cancer. Number 2 is breast cancer, about 1 in 8, and colorectal cancer, about 1 in 10. So these 3 cancers account for almost 50% of all cancer deaths in women in the state. Okay, so the goal today is to talk about things that you can do to reduce your risk of developing cancer, and if you do develop cancer, reduce your risk of dying from this illness. So these are the 6 steps, and what we're going to do is I'll read you the steps, then we're going to go one by one and talk about why the step matters and what you can do to begin to implement the step today. I see a hand. Yes? So melanoma is on the list. It's just not common enough to make the top 6. Yeah, so there are probably 25 extras that if we continued this list, these are just kind of the most common. But melanoma is, in the United States, it is common. The major risk factor is ultraviolet sun exposure. So it's on the list. It just didn't, for brevity, didn't make the cut.
Okay, you said ultraviolet, that's like the sun?
The sun, that's the main risk factor for melanoma.
Okay, but if it's under the bottom of your foot, you don't get much sun.
Yeah, it's still, people do develop it on the bottoms of their feet. They sometimes develop it in their eye. By far, the most common locations are the top of the head, the top of the ears, the top of the nose, usually often on the face or the arms, because that's where we do get most of our exposure. But it does happen, it could happen anywhere you have skin cells where they begin to multiply erratically and you develop a melanoma. But most of the time, they're in locations that you have a lot of sun exposure. Yeah.
So it's rare to have it on the bottom?
It depends how you define rare. It's not as common as other places where you get a lot of sun exposure. Okay, so the 6 steps are get screened. Number 1, by far the most important. Number 2 is to avoid weight gain. Number 3 is to exercise regularly. Number 4 is to consume a healthful diet. Number 5 is to avoid tobacco. And number 6 is to limit alcohol. Okay, so we're going to go one by one through each of these steps. If you integrate all of these 6 steps into your life, and everybody in the state does it, we theoretically could prevent about 45% of all cancer diagnoses and cancer deaths. And really what that translates to in Louisiana is more than 5,000 women not developing cancer and almost 2,000 women not dying from this disease. Okay, so little lifestyle changes that I just described, when put together at the population level, can actually make a very meaningful difference in controlling cancer in the state. So step number 1, get screened. So there are a couple cancers that we screen for in women in the United States. Number 1 is lung cancer. And again, lung cancer is very common and it's a killer. And this test that we use for lung cancer is called low-dose computed tomography, or CT scanning. Basically what it does is it takes a very detailed picture of your lungs to be able to identify very small lung nodules or lung cancers. Who should be getting this test? Individuals between the age of 55 and 74, and those who have a history or are current smokers. So smoking is the number 1 risk factor for developing lung cancer, and we usually only screen individuals for lung cancer who have a smoking history or are current smokers. So those who currently smoke, those who used to smoke but have quit in the last 15 years, and those who have accumulated what we call a 30-pack year history. So what does that actually mean? What is a pack year history? If you smoke 1 pack of cigarettes a day for 30 years, you have a 30-pack year history. 30 times 1 is 30. If you smoke 2 packs a day for 15 years, 15 times 2 is 30. Okay? So the more you smoke per day, the less time you need to smoke in order to meet the requirement for lung cancer screening. Yes?
What about people who have like calcification?
So what about those people?
Well, should they get that?
They might not get, it depends why you think you have the calcification. And ultimately that is a conversation between you and your physician, and it depends on a variety of different things. If you have a history of lung cancer in your family, if you have a history of smoking and things like that, in order to monitor how those growths may eventually transform into a cancer or may increase your risk of developing cancer. Okay, so that's lung cancer screening, yeah.
So on the screening, what about somebody who grew up around a heavy smoker, who was around a heavy smoker for 20 plus years?
So based on the guidelines, you don't meet the threshold for being screened. That's not to say you couldn't screen, it just means your insurance is not going to pay for it because you're not a high enough risk because you haven't been smoker yourself. So secondhand smoke is a major challenge, but if you compare the lung cancer risk of secondhand smoker versus the primary smoker, their risk is much higher than somebody who grew up or lives with a smoker. Yeah. So number 2 is colorectal cancer screening. So for colorectal cancer screening, we have some options. The first is what we call stool-based tests. So these are tests that you can do in the comfort of your home. And basically what they do are they try to identify either fragments of cancer cells or blood in the stool that are suggestive of having a colorectal cancer. So those are stool-based tests. We also have a class of tests that I call direct visualization. So things like colonoscopy or sigmoidoscopy, where we actually take a camera and to be able to identify to look in the colon to try to identify not only colorectal cancers, but precancerous lesions. So things that are growing in the colon that, if gone untreated, will develop into a invasive colorectal cancer. And the benefit of colonoscopy and sigmoidoscopy is if we see something that's a precancerous growth, we can cut it out before it grows into an invasive cancer. And the third option for colorectal cancer screening is what we call visual techniques. And these are things that use, again, computed tomography to take a picture of your abdomen or your belly to try to identify growths in the colon and the rectum. So who should be getting screened for colorectal cancer? For average risk individuals, the age at which you should start screening is somewhere in the order of 45 to 50 years old. And who should be getting screened? Most everyone. If you have a family history or some other concern, you might start screening a little bit early, but generally the recommendation is you start screening for colorectal cancer in your late 40s, early 50s. Breast cancer screening, the primary screening method is mammography. And every year there is debate about when women should start screening for breast cancer who are at an average risk. Should they start screening at 40? Should they start screening at 50? Is it somewhere in the middle? Ultimately, my recommendation is that is a conversation that you should have with your physician, that you talk about to understand the risks and benefits of when you start your screening for individuals at average risk. Yeah?
What if someone in your family had lots of breast cancer? So how does that affect if it's someone in your family? What age then?
Yeah, so we know that having a family history is a strong predictor of an individual patient's risk of developing a cancer, and it depends on if you have had, for example, genetic testing done, which really is a function of how much cancer you have in your family tree. The first slide I showed you, cancer is really common. A lot of our family trees have either cancer or cardiovascular disease, and being able to map out your family tree will allow a physician or a medical geneticist to be able to understand, are you truly at a higher risk because of potentially some genetic predisposition because you have such a strong family history where you would get screened a little earlier. But the reality is many of us have a lot of cancers in our family tree, and it's just because cancer is common and we don't necessarily have any type of genetic syndrome. But again, it's really a conversation to have with your individual physician as to how strong your family tree is, if he or she suspects you have a genetic predisposition, and then once you know that information, kind of going from there. But it's very difficult to provide a kind of a one-size-fits-all. And then the last is cervical cancer. So most individuals in this room probably at some point in their life have had a Pap test. There are also some additional tests now that we use to screen for HPV or human papillomavirus, which is a risk factor for developing cervical cancer. The recommendation is that women between the age of 21 and 65 for average risk should be getting screened. The interval really depends, again, on a conversation that you have with your physician, and most individuals, most women in this age range should be getting screened. So the concern I hear often when I tell people get screened is they will say, I don't want to get screened because if they go looking for something, they're going to find it. And I feel fine now. I don't really want to deal with it. And some people laugh, but it's a true concern of if you go poking around, you're going to find something, and then it causes you a lot of problems. And I will tell you, that is the whole purpose of screening. The whole purpose of screening is to go go in and try to find cancers before you know they're there. Because often, by the time you realize that they're there and you become symptomatic, they become very difficult to treat in that they've often spread to other parts of the body already. Okay, so what I'm going to do is I'm going to show you, this is the data from the lung cancer screening study. And over 10,000 men and women were randomized. Basically, you flip a coin, and if you get heads, you get that low-dose computed tomography, that detailed picture of the lungs to try to identify small lung cancer. If you get tails, you get something that was the old standard of care, which was just a chest x-ray. It was a standard chest x-ray to identify nodules that may be suggestive of a lung cancer. And what you can see is over the period of 8 years, this black line here is the low-dose CT, and the red line is the chest x-ray, chest radiography. On the vertical axis is the number of lung cancers. So you can see that those who got low-dose CT were more likely to be diagnosed with lung cancer. The test succeeded in identifying lung cancers. And that's what people will say, oh, if they go poking around, they're going to find something. And that's the purpose of screening. Because if we look at this right panel, this is death from lung cancer. And what you can see is that these lines have now flipped. So the black line, low-dose CT, is lower than the red line, meaning that the low-dose CT found small lung cancers before they were able to kill somebody. So that's the purpose of screening, is to identify small cancers before they become symptomatic. And we know that from this study that low-dose CT screening for lung cancer reduces risk of death by about 20%, and colorectal mammography for breast and cervical cancer screening reduces the risk of cancer death in the order of about 50%. So why screening works is it identifies small cancers that can be treated before you become symptomatic. So do not be scared of screening. You should have an informed conversation with your physician about the risks and benefits, but don't be scared about screening, that if you go looking for something, you're going to find it. That's the whole purpose. Okay, so the action items. If you have a primary health care provider, talk to them. If you haven't had a conversation about screening, talk to them about the potential benefits of cancer screening. If you don't have a primary health care provider, you can start your screening today, and at the end I'll give you an action item list of things you can do while you're here at Pennington. And if you don't have a primary provider, consider talking to your insurance company to find doctors that are in your network, but also talk to your family and friends to identify physicians that they trust, that you like. You do not want to wait until you get sick to find a doctor that you trust. And often I say that finding a doctor you trust is kind of like dating. Many individuals don't marry the first person that they date. Some people do, but most people don't. And finding the first doctor, you might not like that doctor, and you are trusting that individual with your life. And so when you get sick, you want somebody that you can pick up the phone, that you can call, that you can talk to, that knows your history, that was able to see you when you were well, so that way when you're not feeling well, they're able to spring into action and be able to help you. The last thing you want to do is not feel good and have to be searching for a doctor that has your values and is willing to advocate on your behalf. So it's a little thing that can make a big difference down the road. So step number 2 is weight gain. Avoid weight gain. And at the top is a kind of a fancy equation that we use to calculate BMI, or body mass index. And basically this is just an equation that integrates your body weight, how much you weigh on the scale, and how tall you are, your height or your stature. And what we can do from this is we get this measure of BMI, and we can classify you as to whether you're underweight, normal weight, overweight, moderately obese, or severely obese. So I would say don't worry about the equation, because when you're here today, you can actually get your BMI calculated. So you'll know what your BMI is, and they will tell you what risk classification you're in. So why do we care about body weight so much? We know that excess body weight is associated with a higher risk of developing 13 different types of cancer. Okay, so and these are cancers that are all over the body, many relating to digestive tract, but also relevant to women: endometrial cancer, ovarian cancer, breast cancer, etc. Okay, so being able to manage your body weight is of critical importance. And I'm going to wait because I see lots of people taking pictures. Okay. So the action item for step 2, avoiding weight gain, is to calculate your body mass index. You can do that here today. Determine which category you're in. Are you normal weight, underweight, overweight, obese? And at a minimum is to prevent weight gain. So we know that men and women in the United States at the age of 30 each year gain 1 to 2 pounds. That's just the way it works. And so if you can prevent the scale every year from creeping up, you are providing yourself with some health benefit. If you are overweight or obese, consider how losing even a modest amount of weight can improve your health. And the benefit of modest weight loss is not limited just to cancer. It can be important for cardiovascular risk factors. A lot of people, after they lose weight, they say they just feel better. They can get up and down the stairs easier. Life is just a little bit more enjoyable after modest weight loss. So step number 3 is to exercise regularly. And these are the current recommendations for Americans. And this is the recommendations from the Department of Health and Human Services, which is a part of the U.S. Surgeon General. And basically the way these guidelines are made is that a bunch of experts get in a room and they review all of the scientific literature about the benefits of exercise on various health outcomes, including cancer risk. So the current recommendations are broken down into 2 broad categories. The first is aerobic activity. So these are things that get your heart rate up, get you a little bit out of breath, maybe cause a little bit of perspiration, things like brisk walking. So that's a good example of aerobic activity. And then the other piece is muscle strengthening activity. So with respect to aerobic activity, the goal is at the end of the week to accumulate 150 minutes of moderate to vigorous intensity aerobic activity. Again, these are things that get your heart rate up, cause a little bit of perspiration, maybe get you a little out of breath. Brisk walking. That's the analogy. The old guidelines used to say in order for your exercise to count towards this goal, you would have to do it in at least a 10-minute block. And that rule got thrown away with this guideline. So if you do 1 minute of activity, it counts towards your goal now. Okay, so little things make a big difference because they basically concluded that there's no scientific evidence to say that if you do 9 minutes of exercise, you don't get any benefit, but when you get to 10 minutes, magic happens. It doesn't work like that. Little things make a big difference. So even monitoring your step counts, that is something where you can actually have quantitative information to know how much you're doing. And the muscle strengthening activity, what that really means are things that we know that as individuals get older, they lose muscle mass, their muscles tend to shrink, they lose muscle strength. And particularly for women after menopause, what happens is your bone mineral density starts to decline. And you may say, who cares about bone mineral density? I feel fine. When you start to care about bone mineral density is, for example, if you have a fall. If you have a fall and you have brittle bones, those bones are more likely to break, and that will land you in the hospital. So the benefits of the muscle strengthening activity are they help make your muscles stay nice and large, relatively speaking to your baseline. They keep you stronger, they prevent that muscle strength loss, and they keep your bones strong, which is extremely important as women get into the 4th, the 5th, the 6th decades of life and on. And these activities aren't necessarily lifting big weights at the gym. These can be things like using exercise bands that you do at home, things also like yoga, like Tai Chi, various calisthenics, whether it's sit-ups or push-ups, things that you can do in the comfort of your own home. Little things make a big difference in terms of your muscle strength as well as your bone mineral density. And why do we care so much about exercise? So we know that exercise or physical activity is associated with a lower risk of developing 9 different types of cancer, including lung cancer, which is very common, colorectal cancer, again, very common, and breast cancer, again, very common. And what's important about this is these are independent of your body weight. So if you carry a little extra weight, but you exercise, then you have a lower risk of developing cancer than somebody who carries a little extra weight but doesn't exercise. So you don't have to do it all, okay? So the benefit of exercise in reducing these cancers here has nothing to do with your body weight. Now, if you lose a little weight and you exercise, you get double the benefit. But you don't have to do both in order to begin to derive the cancer-lowering benefits of a healthy lifestyle. Okay, so the action items for step 3 are to get moving. Every step counts. Little things make a big difference. Find activities you like and do them. Again, in some of the studies that I do, we work with individuals up front to try to find activities that they like to do. Because if I tell people to walk on the treadmill and they don't like walking on the treadmill, once I go away, they go, thank God that guy is gone. I'm done with this. And so what I want you to do is experiment and find things you like. And a good example that I use is we had a participant in our study. She did not want to walk on the treadmill, hated it. And I said, all right, fine, let's think creatively about what activities you might like to do. And it was her idea. She figured out. She goes line dancing twice a week. And I said, well, do you get your breath up, a little out of breath, a little? She said, oh, yeah. And she showed me a picture, and I was like, oh, yeah, this is definitely activity. And it counts towards her goal. She goes an hour twice a week. I think it's Tuesday and Thursday. And so that counts as the activity. So you can think creatively about the types of activities you do. Gradually increase your activity levels over time. We're trying to create sustainable change. We don't go from 0 to 100 overnight. Little things make a big difference. So as long as you're trending up and going in the right direction and doing a little bit more week over week, that's what matters, okay? And some activity is better than no activity. And the example that I give is historically, if somebody had a heart attack and ended up in the hospital, the goal was rest. Take it easy, lay in the hospital bed, you just had a heart attack, you need to recover. Now, if you have a heart attack and you're admitted to the hospital at 9 in the morning, by 1 in the afternoon, you're out walking the hallways with your IV pole because they know that getting people up and out of bed is good for your health. Little things make a big difference with respect to trying to avoid sedentary behavior. Okay, so step number 4 is consume a healthful diet. So it's really hard to quantify what it means to have a healthy diet. We all have different factors that influence the type of foods we eat, how we prepare those foods, etc. It may relate to geographic variation. So for example, I grew up in New York and I spent almost all of my life in New England, in Massachusetts and Pennsylvania. And then I moved down here and the food is very different. I'm not going to say it's better or worse, it's just very different in how it's prepared and the types of food that are eaten. There also may be various ethnic or religious reasons why you eat a certain diet, and the goal is to be able to think within a general framework that respects your choices and your cultural preferences and your religious preferences to be able to optimize your diet. So this is the general framework that we use to think about what it means to have a healthy diet. So at the foundation of this pyramid are fruits and vegetables, really the backbone of consuming a healthful diet, healthy fats and oils, things like olive oil, and whole grain foods. So that is the foundation, and really those are the staple things that provide us with a healthful diet. Then at the second level, in a little bit less moderation, are nuts, seeds, beans, tofu, fish, poultry, eggs, kind of lean protein sources. Then even in less quantity are dairy products or vitamin and calcium supplements. And this is important for, again, particularly after menopause, to be able to maintain bone health. And I will say that if you consume a healthful diet, there is often very little value or incremental benefit you get by consuming supplements. So if you consume supplements, I would encourage you to have a conversation with your primary care provider or a specialist to be able to understand if those supplements are actually providing you with additional health benefit. And the reason that I say this is often insurance doesn't pay for supplements, and people are paying their hard-earned income to try to improve their health. And if it doesn't improve your health, it's not worth your money. So often, if you consume a healthful diet, taking additional supplements doesn't provide you with any incremental benefit. Okay? The only people who kind of most obviously derive a benefit from supplements are those who have dietary restraints on what they can eat. For example, vegetarians. Because they don't eat the full pyramid, they may have specific nutritional deficits that can be corrected with a supplement. So it's just something to think about. I'm not saying stop taking your supplement. I'm just saying have a conversation with your physician about the benefits that that supplement is providing above and beyond consuming a healthy diet. And why do we care about this? So we know that consuming a diet that contains abundant fruits and vegetables, dairy, nuts, legumes, and whole grains, and limits red meat, sugary beverages, things that kind of have empty calories, refined grains, and sodium or salt lowers your cancer risk by 10%. And this is independent of the amount of exercise you do. This is independent of the amount that you weigh on the scale. And so the benefit of this is that the foods you eat have an impact on your lifetime risk of developing a cancer. And this also includes the DASH diet, which a lot of individuals follow to control their blood pressure. So the DASH diet falls into this, as well as the Mediterranean diet, which has gained a lot of popularity over the past couple years. So both of these dietary patterns fall into the cancer-lowering dietary pattern. Okay, so the action item for step 4 are be realistic, set small attainable goals. Set small goals, meet those goals, then set the next goal, build momentum, build self-efficacy, build confidence. Second is to stick with it. If what you're doing isn't working, change it up. And that's what we do all the time. We try something, if it doesn't work, we go back to the drawing board, we try another solution. It's very frustrating to try something that's not working. So take a step back and see what options exist, and then decide how to move forward. Take time to enjoy your food. So I violate this every day. I engage in what I call distracted eating. I will be sitting at my computer doing email, and I'm eating lunch, and I'm eating, and I'm eating, and I'm eating, and before I know it, I've eaten way more than I had intended to do. So and it's because we're busy. We got a lot going on. We got to eat, and we got to do our work. Or we got to take care of errands. We got to do things. But if you can actually be in the moment when you eat, your brain receives signals that say, hey, we're getting full. And you stop eating, or you say, oh, I have one more bite and then I'm done. But if you engage in distracted eating, your brain avoids those signals because it's distracted, and you just eat and eat and eat. So try to be mindful. And last is, remember that you're not going on a diet. When I say the diet word, a lot of people get psyched out. What you're trying to do is build healthier habits for a lifetime. So a diet is, in my view, it's something you go on for a discrete amount of time to reach a goal, and then once you've reached that goal, you move on. Doing this, building healthier habits, is something that when you say it, you want to do it for the rest of your life. And that's what I'm trying to do, is help you start to think about solutions that can be sustained. Because that's what matters, is little change that is sustained over a lifetime can make a very big difference. Step number 5 is avoid tobacco. So for those of you who do consume tobacco products, there are a lot of options out there. First is just to quit cold turkey. It's very difficult for people. Smoking is a very difficult behavior to stop. It is an addiction. And very few people are successful in just saying, I'm just not going to smoke, and it's willpower. It's very difficult to do. Ultimately, the most successful approaches to smoking cessation combine multiple different approaches. Things like behavioral therapy, to try to identify triggers that make you want to smoke. Are there certain situations, are there certain people that make you just want to start smoking? And to try to avoid or minimize those types of triggers. Third is there are a variety of nicotine replacement products. So nicotine is the thing that's really addictive in tobacco products. And we have patches, we have gum, we have nasal spray, we have inhalers, all to be able to try to curb that stimulus without actually consuming combustible tobacco. We have medications. We have FDA-approved medications that help individuals reduce their desire to quit smoking. And ultimately, the best, the most success comes from combining multiple different options. So the way I say is, think about this as a toolbox, and ultimately you want to work to try to find what is the optimal combination of tools to be able to reduce your desire to smoke. And why is this important? Is because we know that tobacco causes 12 types of cancers all throughout the body, okay? So I'm not standing up here shaming you if you consume tobacco products, because it is a very difficult habit to quit, okay? But I believe you can do it, and your health will improve immediately upon quitting. So do not give up. Keep trying to quit smoking, because eventually, with one of those attempts, you will be successful. Do not give up on yourself. I'm not giving up on you, okay? Keep persisting at it. So the action items for step 5 are decide if you want to use a quit aid or what quit aids are available to you. Many of these quit aids are covered by insurance in order to help individuals live longer, healthier lives. Set a quit date. Try to hold yourself accountable to reaching your goals. Identify smoking triggers and identify ways to eliminate or reduce those triggers, whether it's certain environments or certain people that really urge you or make you want to smoke. Get support. Don't do it alone. We're all here to support one another. Your family's here to support you. It's very hard to do this in isolation by yourself. And last is don't get discouraged. This is an extremely hard habit to break, and multiple people who have successfully quit have tried 5, 10, 15 times, and eventually it sticks. Don't give up on yourself. And last is to limit alcohol. So just so we're all on an equal playing field, this is how we define a serving size of alcohol. It's 1 12-ounce beer. It's 1 8 to 9-ounce glass of malt liquor. It's 1 5-ounce glass of wine, or 1.5 ounces of some type of spirit, whether that's tequila, vodka, rum, etc. And the current recommendations are that women consume, on average, no more than 1 to 2 servings per day. Okay, so that is the recommendation, and one of the reasons we make that recommendation to avoid alcohol excess is because we know that excess alcohol consumption is associated with a higher risk of developing 6 types of cancers. Most of these cancers are cancers on the digestive tract, where the alcohol actually comes into contact with the tissues, but also it does increase your risk of developing breast cancer. Okay. And there are emerging data that excess alcohol, so drinking more than 1 to 2 servings per day, increases your risk of pancreatic cancer as well as stomach cancer. So again, more cancers on the digestive tract. So the action items for this are, if you regularly consume more than 2 drinks a day, on average, consider how reducing your drinking may improve your health. And if you don't currently consume alcohol, don't start drinking for the purpose of trying to lower your cancer risk. Now, I'm not saying completely abstain from alcohol. There's nothing wrong with indulging every once in a while, but it is chronic, sustained use that will increase your risk of developing cancer, in addition to a variety of other important health factors, health conditions, such as cardiovascular disease. So in summary, the 6 steps are get screened. Number 1, most important. Number 2, avoid weight gain. Number 3, exercise regularly. Number 4, consume a healthful diet. Number 5, avoid tobacco. And number 6, limit alcohol. So the bottom line is you can take steps to reduce your risk, and there are individuals who do all the right things and ultimately do develop cancer, and that is the piece of the bad luck puzzle. It does exist. It's very frustrating. It's very unfortunate, but the bottom line is there are things that you can do that are in your control in order to try your very best to optimize and reduce your long-term cancer risk. Today is a great day to start taking these steps. If all this is kind of new and you've never really thought about it before, this is a good opportunity to start thinking about these issues and put them on the radar. The more steps you take, the lower your risk. So if you can do 1 of these steps, it's better than doing nothing. If you can do 5, it's better than 4. The more you do, the lower your cancer risk. And remember that little things make a big difference over time. Little change every day over 5, 10, 15 years provides you with substantial health benefits. So think how little changes can make a big difference. So the to-do list, things that you can actually do here, if you're interested, you can do colorectal cancer screening. They are handing out screening kits. If you haven't been screened before, we can also do breast cancer screening outside in the mobile unit. You can get mammogram. Also, we do skin cancer screening here today. You can have your body weight assessed. We will calculate your body mass index. You can get your weight, you can get your height. We'll calculate your BMI, body mass index, and understand what category you fall into. And also, I have to give a plug for the clinical trial opportunities that exist here. So I'm a clinical researcher at Pennington Biomedical, and I do lifestyle interventions to be able to try to understand the benefits of these different things in reducing an individual's risk of developing cancer. And the benefit of participation is you get a lot of free health information. We take tons of measures on you as study participants, and you're entitled to those measures, and you can share that information with your physician. You also get access to new programs, new things that you might not be able to get in the community, in addition to being able to access medications that might not be available to your doctor just yet. And you can learn more about our clinical opportunities at the Pennington Biomedical tables. We do studies with preventing diabetes, managing diabetes, weight loss among those who are overweight, weight maintenance among those who are healthy weight, exercise, healthy diet. Everything you could think of, there are opportunities here. And one of the benefits is, time is one of your most precious assets. Many studies compensate people for participating in the study because we value your willingness to contribute to move science forward, but we realize that your time is very valuable. So many of these studies also provide compensation. So if any of these are of interest, often clinical trials can be used to jumpstart healthy behavior, and we get you going, and then you finish the study, and you're on a trajectory of success. So think about how participating in a study may be helpful. Maybe not today, but down the road. So if this is of interest, stop by one of the tables. I think we have 55 studies going on now, so there's probably something that is of interest to everybody. So I'll stop there. I'm happy to take any questions. If anybody wants to ask me things that you might not want to ask in front of other people, I'm happy to stick around and talk to you guys afterwards. Thank you, guys.